trauma or irritation, and it's common in the gingiva. Next, we have nodular fasciitis, which is a neoplasm of fibroblasts. And you tell there's a theme here. I'm putting in red sort of the cell or the tissue type that's involved in the reactive or neoplastic growth for these connective tissue tumors. That's a pretty important thing to remember. The neoplasm of fibroblasts, of course, fibroblasts are the cells that secrete collagen fibers and other fibers. And they're easy. This lesion is pretty easy to eradicate, rarely recurs after surgical excision. Now, a very related lesion to this is fibromatosis, which again is the neoplasm of fibroblasts. But this one is difficult to eradicate and often recurs. So similar yet very different to the nodular fasciitis. And here's a picture, just looks a bit more serious than the last one we talked about. Next, we have granular cell tumor. And this now, instead of fibroblasts, we're talking about a neoplasm of Schwann cells that are responsible for making myelin to cover the axons of nerves. So they're named such because these tumor cells have a granular cytoplasm. So if we're looking under a microscope, the histology is this granular cytoplasm, and that's why it's named that. Now this super long word here, pseudoepitheliomatous hyperplasia, or PEH for short, is present in this tumor, and it mimics the appearance of squamous cell carcinoma under the microscope. And that's because it has this very proliferative epithelium. They think, oh my gosh, is this cancer? No, it's actually just something that you'd find in a granular cell tumor if you took the biopsy. Now this is most common on the dorsal tongue, which I have pictured here. It's a little hard to orient, but that is the dorsal tongue. And it's a variant on gingiva is known as the congenital epilis of newborn. And it's also kind of a lump or bump, like all the things we've talked about so far. But this time, if you did a biopsy, looked under the microscope, it wouldn't have this characteristic PEH, but otherwise would have the granular cytoplasm, everything else be similar in terms of a neoplasm of Schwann cells. Next, we have the schwannoma, also known as neuruloma, and I had to double check that spelling because it is a little bit strange. A schwannoma, to no surprise, is a neoplasm of Schwann cells, yet again. And this time, if we look under the microscope, we're doing a lot of histology here. It has these acellular Vacay bodies in A2. I know it's a lot of kind of random words, but this does seem to appear on a couple of practice exam questions. And it forms this sort of line of scrimmage is one way to think about it. In American football, when the two teams line up before every play, it forms sort of these two lines that you can see in the histology that someone termed that. So next we have neurofibroma. And this is, if we're looking at the name here, the roots of something nervous and something fibrous, neurofibroma is a neoplasm of Schwann cells and fibroblasts. So that makes a whole lot of sense, thankfully. And we have yet another syndrome, neurofibromatosis type 1, or also called von Recklinghausen's disease. So a lot of long names here, but hopefully it's all kind of sinking in just a little bit. So this syndrome involves multiple neurofibromas plus multiple skin freckles called cafe au lait spots, and axillary freckles, so in the armpit would be the crow's sign, plus iris freckles of the eye, or these leash spots. So I listed them out with all these freckles because it helps you kind of to remember, oh, this is the Frecklinghausen's disease. And neurofibromas can transform into neurofibrosarcomas in this syndrome or disease. So that's an important distinction. Usually these neurofibromas would be benign, but you have a risk of malignant transformation to the cancerous form with this disease. And we just have 3 more benign connective tissue tumors before we wrap up this video, and they are the leiomyoma, which is a neoplasm of smooth muscle cells, lyo and myoma for muscle, the rhabdomyoma, a neoplasm of skeletal muscle cells, and lipoma, this root always referring to fat, neoplasm of fat cells. And this one's most common on the buccal mucosa. You can kind of see this yellowish nature is usually something